Good afternoon, everybody, and welcome to our liver health awareness session today. My name is Amy Caffrey, and I am the Outreach Project Manager here at British Liver Trust. And I'm hoping today that to give you an insight into what the liver is, talk about some maybe preventable liver conditions that are out there, to talk about British Liver Trust and Liver Cancer UK, so who we are and what is it we do. And I really hope that you learned something from today and take something away with you. So, what I'd like to ask everybody who's watching today is to have a think about throughout this presentation of something that you could do in your life that could help you to improve your liver or to look after your liver health better. So, throughout this presentation, I would like you to have a think about that. So, as mentioned, my name's Amy. So, I have been working with the British Liver Trust for 9 years now, and I really enjoy working with a health charity. I find it really fulfilling. The day-to-day life of an outreach project manager, what do I do? What is that all about? So we do things like this. So we come along and give education sessions, so talk about the liver and what it does. I also head up our patient support group. So we've got different support groups for people affected by liver disease and liver cancer. So I run those across the UK. I've got a lovely outreach team who are based all across the UK, and we go out into the communities and we raise awareness and we offer support to people who are affected by liver disease or liver cancer. So without any further ado, I will get into the presentation, and I really hope you enjoy it and hope you learned something from it today as well. So I'm going to start off talking about the liver itself. So what is your liver? Why do you need it? And why is it important? So your liver is the largest solid organ in your body. It weighs about 1.8 kilos in men and about 1.3 kilos in women. So it's quite a heavy, big organ. It has over 500 functions. I'm not going to read out 500 functions or we'll be here all afternoon, but I have summarized some of the key functions that keeps your liver going. Your liver is like the powerhouse of your body. So it does really important jobs for you to keep you alive and keep you well. Things like fighting infection. It filters out toxins. It helps your blood to clot, and it also aids with digestion. So it does a lot of the really important things to keep your body moving and keep your body healthy. It's the only internal organ that can actually regenerate itself. Now, I will talk a bit more about this later on, but one of the myths that we get from people saying is, oh, the liver's fine, it can just regenerate. It absolutely can, but only up until a point. And I will talk more about that because it's really important for people to understand how that process works and why it's important that you take some steps and responsibility of looking after your liver as well. Now, your liver is what we refer to as like an elastic band. So what do we mean by that? So your liver can stretch so far before it breaks. If you see that picture of the person with the blue hoodie on, there's a holding the liver. That is a life size of a human liver. So your liver, by looking at that, is quite big. And if you put your hand on the right under your right rib cage, under right side of your body, that's where your liver sits. So your liver sits in there in your body, okay? And if your liver is healthy, it will be soft and squishy. And it can take a lot of resistance before any symptoms or any damage kind of shows that it's there. So that's kind of why we say it's like an elastic band. It can stretch quite a fair bit until it can't stretch anymore. And I'll talk a bit more about that in detail in a bit. It won't let you know you're struggling in the early stages. So that's the hardest part about liver disease. Often it's found when it's far too late. So what we want to do is try to educate people on how can we find that early? What is the importance of early detection? And how can we help ourselves to look after that? So liver disease is a crisis in the UK. And what do I mean by that? So there are more than 600,000 people in the UK living with a serious liver condition. And deaths from liver disease have increased by 400% since 1970. So if you have a look at the graph here, you can kind of see, I know it's a bit small, but if you can see it, you can see that liver disease is completely on the rise, way up there. And other diseases like diabetes, heart disease, some cancers, they're all coming down the way throughout the years. But liver disease is still spiking up way. And there's a number of different reasons for that. One reason could be lack of education. People don't understand it. There's this stigma behind liver disease. It's completely, most people think it's about alcohol. One survey told us 94% of adults associated alcohol with liver disease. And actually, there's a lot more to it than just that. So that can prevent people from coming forward asking for treatment. It could be a late diagnosis. There's lots of different things. But again, as I said, the symptoms don't show until it's far too late. So there's a lot of reasons why this has spiked upwards since the 1970s. And this is a trend that we really want to reverse. Now, if we put that into context, there are more than 40 people die every day of liver disease and liver cancer. And 3/4 of these people will be diagnosed with cirrhosis in a hospital setting, and they often die within 60 days. So that's a very, very short amount of time from diagnosis. 9 out of the 10 of these cases are preventable. So it's really, really important that we educate people on what your liver is, how to look after it, and how I can give myself the best chance. So what is really shocking is that liver disease is the biggest cause of death between those aged between 35 to 49 years of age. Now, that is very, very young. So that is something that we really want to try and help by early detection and making some lifestyle changes in there too. One survey did tell us that only 5% of adults said they'd have a great concern if they discovered a liver problem, whereas 72% had said they would have great concern if it was their heart. So why is that? So we really want to educate and explain why it's really important that you keep your liver healthy as well. So I'm going to talk to you briefly about the causes of liver disease and the stages of liver disease. Okay. So the three main causes are, as we know, alcohol is linked to liver disease. And yes, it's still a big cause of liver disease. So it accounts for kind of 60% of all cases of liver disease is related to alcohol. But what I really want to get across is that even moderate drinkers can develop liver damage. You do not have to be a heavy drinker to develop liver disease. And that's really, really important because in running the support groups that I run, we see people from all walks of life and coming and saying, my friends drink a lot more than me. How come it's me? There's lots of different reasons. You do not need to be heavily drinking to develop it. So it's really important to understand that. Being overweight, so non-alcohol related fatty liver disease, which we shorten to as NAFLD, it affects 25% of the population who are obese. So being overweight, having poor diet, lack of exercise, sitting down too much, that can all play a factor in developing liver disease as well. And viral hepatitis. So I will speak a bit more about viral hepatitis in a bit and explain what that's all about. So 90% of liver disease is preventable, which leaves 10%, which would be caused by an autoimmune or genetic condition. So not everything is in our control, but 90% of it can be. So that's really, really important. But there is 10% of cases out there. It's got absolutely nothing to do with lifestyle at all. So it's a real balance. So when we talk about liver disease, how does that work? So there's 3 stages to your liver. So the first one is healthy liver. So where your liver is absolutely fine and it's working well and it's performing all of its functions really, really perfectly. Now, what happens to your liver when it responds to harm and then it becomes inflamed? So your liver becoming inflamed is what we call hepatitis. Hepatitis means inflammation of the liver, okay? And if the harm is repeated, new liver cells can't regenerate fast enough. And this turns into what we call the next stage of liver disease, which is fibrosis. So you're starting to see some fibrous scaffolds scarring your liver, some fat maybe building up on your liver, causing it not to work as properly. Now, the scary thing about this is there may not be any signs or symptoms at this point. So what we want to do is catch people at these early stages of fibrosis because these can absolutely be reversed, or in most cases be reversed. So by making lifestyle changes as early as possible, it can prevent your progression of liver disease, or it can, in some cases, reverse some of it as well. So that's how we get the regeneration of liver disease, that it can become reversible. At this point, it can. However, if we don't make any lifestyle changes and harm continues to happen, this is what develops into cirrhosis. So cirrhosis of the liver is irreversible. Now, cirrhosis just means end stage liver, but you can live with cirrhosis for a very long time if you're monitored and you're doing as your doctor tells you. Okay. So what we want to do is make sure it doesn't get any further at this point. You want to make sure that your liver is kept at this and doesn't develop further on. So that's kind of how the liver works. So it can regenerate to a point, but very important to understand how that works. So what are the symptoms to look out for? So in the early stages of liver disease, the kind of general symptoms would be things like feeling unwell and tired all of the time, having a disturbed sleep pattern, loss of appetite, muscle wasting, feeling sick, so having nausea or vomiting, having tenderness or pain in your liver area. So remember I said that was on your right-hand side under your rib cage. Having spider-like small blood capillaries above waist level, which we call spider angiomas, or having blotchy red palms. Now, what's really, really difficult at this point is that a lot of these symptoms can be anything. They may not be your liver. They could be anything, like a sign of a common cold or an infection, anything. So it's very, very difficult to diagnose at this point, which often happens. The severe symptoms don't really start until it's quite late on. Okay. So our later stage symptoms, and if anyone ever had any of these symptoms, please go to your GP straight away. So things like swelling of your abdomen, we call that ascites, bruising easily, yellowing of the whites of the eyes and the skin, which is called jaundice, intensely itchy skin, memory loss, confusion, drowsiness, forgetfulness. So if our liver is not working properly, the toxins can't be flushed out. So what happens is they actually go up to our brain, and that can cause confusion and memory loss. So that can be a symptom of late stage liver disease. Vomiting blood, so that's another sign that our liver could be in trouble, or having black tarry poo or dark urine. So again, just to reiterate, if you ever had any symptoms like this, please go and speak to your GP. So I want to talk to you a little bit about the preventable liver disease. So there are a lot of things that can be lifestyle related that can damage your liver. So we all know that alcohol is a contributor to liver disease, and 1 in 4 of us drink in a way that could harm our liver. So the government suggests that we drink within the 14 units a week, and we space that out to having 2 to 3 alcohol-free days a week. So if you think about how alcohol goes through your liver can get rid of 1 unit of alcohol or get rid of that per hour. So if you're drinking a bottle of wine, that's 10 units, that's 10 hours, a couple of pints, it all adds up. So you really have to think that going over the 14 units can be a very easy thing to do. So it's very, very important to realize that it's keeping within those units and spreading that out during the week and not saving them up to binge them all at the weekend. So alcohol is still in the UK the biggest cause of liver disease, but it's slowly catching on with NAFLD. So our non-alcohol related fatty liver disease, that's on the increase. And NAFLD is estimated to affect up to 1 in 5 people in the UK. And these rates are increasing as obesity increases. So the most cases of NAFLD are linked to excess weight, so being overweight. But you can also develop this disease if you have a healthy weight. So there are things that can increase your risk of NAFLD, things like a high weight measurement, having type 2 diabetes, having a diet with too many unhealthy foods and drinks, having low levels of physical activity or spending a lot of time sitting down, having high blood pressure or high cholesterol. But it can also be related to things, conditions that are insulin resistant, like polycystic ovary disease. So there are things that can contribute to it, but the main kind of cause of it is diet related. And the other type of preventable liver disease is what we call viral hepatitis. Now, hepatitis just means inflammation of the liver, as I've kind of mentioned earlier. But there are several different viruses that can cause hepatitis. So you've got hepatitis A. So that is normally, it's not quite common in the UK, but that happens if there's an ingestion of contaminated food or water. So often if you're going abroad to other countries, they may ask you to get a hepatitis vaccine before you come out. And that's kind of the reason why, is to protect yourself from that. But the two that we see the most commonly in the UK would be hepatitis B and hepatitis C. So hepatitis B and C, they're both bloodborne viruses. Hepatitis B is normally passed from mother to child during childbirth. And hepatitis C is a bloodborne virus that comes through blood-to-blood contact, okay? But there are a number of things that you can do to protect yourself from viral hepatitis. So things like don't share razors or toothbrushes with anybody. Make sure that you cover wounds if you were cut. If you're getting a tattoo or a piercing, make sure that you go to a licensed studio where all the equipment has been sterilized. Never sharing drug equipment or using rolled up banknotes. And if you're abroad and you need a medical treatment, make sure it's somewhere that uses sterile equipment. So all of these things can protect you from your risk of developing viral hepatitis. So how can I look after my liver health? What can I do to help myself? So there are a number of things that you probably do every day and don't realize it, but it actually has really good effects to help you with your liver. So think of, in terms of alcohol, have a maximum of 14 units a week, but spread it out and have 2 to 3 alcohol-free days each week. Don't save up your several days allowance and drink it all at once. You know, we often hear, at Christmas, people might go a little bit crazy because it's Christmas and we're enjoying ourselves and we're socializing, but then I'll do dry January, so it'll be okay, and it'll even out. That's absolutely not true. It has to be a lifestyle. It has to be consistent. You can't binge at one side and then it will recover on the other. You have to give your liver time in between to regenerate those and produce those new liver cells. So really, really important to follow those guidelines if you like to have a drink. The other part is eating lots of fruit and vegetables, so they're really good for you. Aiming to have your 5 a day. Drink plenty of water. So as we said, the liver plays a huge role of flushing out toxins. So drinking plenty of water can help with this. And try cutting down on sugary and fatty foods. So they're all a big risk of developing liver disease. So trying to cut down as much as you can is really, really helpful. Having at least half an hour's exercise a day, leaving you warm and slightly out of breath. So we're not asking people to go and run marathons or swim 50 laps a day, but what we're saying is get moving, get yourself up and about. You can go out and cut your grass, do your gardening, do your housework, get out with your dog, whatever it is you like to do. Find something enjoyable that will leave you slightly out of breath and warm and exercising and moving about. So it's all about movement and getting your body moving. And the other one is protecting yourself from viral hepatitis. So kind of the things I've mentioned before, just making sure that if you were getting a tattoo or a piercing, that it is somewhere that was safe and sterile. So all of these things will really help you to look after your liver. So that there's some really simple steps here that can help you. So I want to talk to you a little bit now about British Liver Trust. So who are we and what is it that we do? So British Liver Trust, we are the leading UK charity for adults affected by liver disease and liver cancer. So we provide information and support to anyone affected by liver disease and liver cancer. We work to increase awareness of liver disease and liver cancer to a wider audience. We work for early detection and better treatment of all types of liver disease. And we work in partnership with healthcare professionals to drive up standards of care and encourage more research in this area. So that is what we do as an organisation. We're a very small charity. There's just about 40 of us across the whole of the UK, so we're spread out quite far. But we cover a lot of different projects. So I'm going to talk to you about a couple of projects we're doing at the moment. But if you want to learn a bit more about what we're up to or see all of the projects we're doing, please do check out our website at the end of my presentation. So one of the campaigns we're working on at the moment is called Make Early Diagnosis Routine Campaign. So as I kind of said before, about a quarter of people who are diagnosed late with cirrhosis in hospital die within 60 days. So it's really, really important that we find liver disease earlier, and we need GPs and primary care nurses to proactively look for it in their patients. So if you see anyone with those symptoms, to check your liver, check if it's doing okay, and go from there. So if you have a look at this map of the UK, you'll see there's 3 different colors, or 4 if you've got the black area, but there's 3 main colors on this map. So anything in green means that you live in an area with a full liver pathway in place. If you live in somewhere in a yellow region, you live somewhere where there's a partial pathway or a pathway in development. And if you live in an area where the map is red, you're living in an area where there is no commissioned pathway for liver disease. And our aim at British Liver Trust is to turn that map green. We want to see that everybody gets access to the same treatment and the same support, no matter where in the country you are. So one way that you can help if you want to get involved with this is writing to your MP. So we're lobbying the government to make early diagnosis routine. We want them to take this really seriously. So if you go on our website, you can type in your postcode and it'll come up with who your local MP is. And from there, it will create a template email, which all you click is send from so put in your email address and click send, and it will send to your local MP, and it will come up with a template email explaining why this is so important and why we want early detection to be routine and early diagnosis. So why we are so passionate about this is because the number of people dying prematurely from liver disease has doubled in the past 20 years. And again, 3/4 of these people have been in an emergency setting. You could go in with a broken arm. You could go in with a bleed. You could go in with vomiting blood, and all of a sudden you've been told you've got liver disease and never knew before that. So it's really, really important that we try and find this as early as possible. And for most people, at this point, the only option is transplant. But the numbers of people waiting on the transplant list have also almost doubled. So there's 50% more transplants being done than 10 years ago. So there's roughly about 1,000 transplants being done per year in the UK. But at any one time, there's 350 people waiting on the list for a liver transplant. So it's really important that this campaign, that we want to make sure that people are getting diagnosed early enough where there's better treatment options for them. So how do we help people? How can we help? So as I've mentioned, we work with adults over the age of 18. We're the leading UK adult charity for liver disease and liver cancer. And one of our services that we have is we've got our liver nurse helpline. And as it is International Nurses Day, a big shout out to our brilliant liver nurses who work with us and support people every day. They're absolutely phenomenal. All of our nurses are ex-NHS nurses with years and years of experience between them, and they run our liver nurse helpline. So this is a free phone number and it's open every day between 9 a.m. and 3 p.m. They don't offer medical advice. We do not diagnose over the phone, but what they can do is they can empower you as a patient, or offer you some advice on how to look after yourself, or signpost you where you need to go. They're absolutely phenomenal. So if you're ever worried about your liver health, or you were diagnosed with a condition, didn't know where to turn to, the liver nurse helpline is a really good source to speak to them. We also have an online liver health screener. So you can go on our website and type in our liver health screener and check if you're at risk of liver disease. So by filling in this lifestyle-based questionnaire, it can tell you if you're at risk of developing liver disease. We've got our Love Your Liver Roadshow that goes across the UK. So you can see a picture of our beautiful mobile unit there. I'm going to talk to you a bit more because I've got a whole slide on that, because it's a very exciting campaign tool that we use. So I'll talk a bit more of that in a minute. We have virtual support groups that run across the UK. So these groups are patient-led and volunteer-led. And the aim of them is to bring people together to share experiences and offer one another peer-to-peer support for anyone going through their liver journey. So inclusive of patients and family members and friends as well. So everyone affected is really welcome to join. It's really important. It's become like a real liver family. So anyone who comes is welcomed right in, and the support they get is phenomenal from the volunteers and the patient leads in there. We also have an online liver health community. So we've got a Facebook group for people who want to join that are affected by liver disease, to find out about support groups. So things like what topics might be coming up, what speakers we might have. But we also have an online health community, which is called Health Unlocked. So Health Unlocked is where it's like a Facebook site for health, if you like. So the section we run is the British Liver Trust section, and members can post questions and share experiences. It's a moderated forum hosted on Health Unlocked, and it's recommended by NHS Choices, and it's moderated by the British Liver Trust. So anything up there gets moderated and checked as well. So a really, really good, useful place for people to ask questions if they're worried about anything, or even just sharing updates of how people are getting on. We also have free informative resources for patients. So we have a range of leaflets ranging on everything from information about the liver itself, information about liver health, information about various health conditions, and also about liver cancer as well. So we've got lots and lots of information on our website that is free to download, or can be requested by post as well. We have a number of liver health and awareness talks and events on our British Liver Trust YouTube channel. So you'll probably come across me quite a few times on that with some presentations. But we have topics across the year that we have as a webinar style, which people can then watch and go back to in their own time. So we've got a British Liver Trust YouTube channel that you can go and watch previous sessions on there as well. So I want to tell you a little bit about our Love Your Liver Roadshow. So as I mentioned, that is our lovely mobile unit, which is currently in Belfast today, outside Belfast City Hall. I might add, if anyone is watching from Northern Ireland. But our Love Your Liver Roadshow is this unit that goes around the UK raising awareness of the importance of early detection and the major risk factors of liver disease. So we use it as a campaigning tool for improving early detection in the local community and in mainstream healthcare. So if I went along to one of these events, what would happen? What would I find? What would I do? So you'd come on board and you'd be asked to fill out the health screener. So you can also do it on our website. So I would advise everybody to go and try that. But you'd also get a chance to fill it out again here, and then you'd be offered to get a FibroScan. So a FibroScan is a non-invasive scan of your liver. So it's similar to an ultrasound, non-invasive, non-painful, and it gives you a kind of a snapshot of how your liver is doing. So it gives you an idea of how your liver health is doing. Now, if you got a FibroScan done the NHS, if you got done privately, it's about £500. So it's a very expensive test just to go and get done. We're offering these free liver health checks for free. So we're going around the UK trying to raise awareness of the risk factors and help people to get diagnosed earlier. So but we are not medically diagnosing anyone on this unit. It's purely to raise awareness and to help people change some lifestyle factors if they want to. We're there to support people and to try and educate people. 1 in 5 people who come on to the roadshow show a a reading indicating a risk of liver damage. And if that happens, they get a letter to take back to their GP for further investigations. So we run about 33 of these a year across the whole of the UK. As mentioned, we're currently on a Northern Ireland tour up in Belfast, but have a look at our website and you can see on the map where we're going to be this year. So keep an eye on that for up to date where we're going to be stopping. Now, if you don't see the area of where you live on that, don't worry. We do go to different places every year. It depends how much funding we get. So if we get funded to go to certain areas, we will come there. So we will do our best to get around as far as we can. This unit, we don't receive any government funding at all. So anything that we get is based on donations. So if we get enough donations, we can go around with this amazing unit to be able to do this fantastic work. So it's a brilliant campaigning tool and really useful. If anyone is in any of the areas where we have an event, please come down, come meet some of the staff. Everyone at British Liver Trust is very lovely, and you can get a free liver health check as well while you're there. Now, in October 2022, we launched our sister website, which is part of Liver Trust, which is called Liver Cancer UK. So our goal is to reach more people and support more people affected by or at risk of developing liver cancer. Now, liver cancer is the fastest rising cause of cancer death in the UK, and it's risen by almost half in the UK in the last decade. So incidents have risen half in the last decade, and only 13% will survive for 5 years or more after diagnosis. So this is very frightening because why is this such a poor prognosis? Why is it one of these less survivable cancers? What's happening with this? And basically the answer is it's diagnosed too late, where there were no obvious symptoms, and by the time it's diagnosed there is a lack of treatment options. So anybody who has got cirrhosis is at a higher risk of developing primary liver cancer, which we call HCC. So they will be under surveillance and being get checked every 6 months, but it's very important to make sure that you get those checks to check for that. We hope we're working on with the Less Survivable Cancer Task Force to improve this. We want this to improve. We don't want this to be only 13%. So hopefully this will improve. But if anybody needs us, we've got a whole range of information and support on our Liver Cancer UK website. Now, definitely worth checking that out. So how can you help? If you wanted to get involved, what could you do to help us? So there's a lot of different things that you can do. So as I've mentioned, we rely purely on donations. We do not get any government funding. And often people say to us, oh, but you're part of the NHS. We're not part of the NHS. We're part of the charity sector, and we rely solely on donations. So if you wanted to get involved, you can take on a challenge, get active, do a bit of fundraising for us, have a coffee morning, join our weekly lottery, £1 a week, and you can earn up to 25 grand. I mean, that's pretty good. Or you can scan the code to find out about more opportunities. Or you can also help by volunteering with us as well. We're always looking for people to put up posters in your local area. So getting up in libraries, pharmacies, GP practices, come out to one of our runs, one of our marathons, and come and support the people who are doing it. Anything that you can do to help and raise awareness and get this message out would be really, really helpful. So we'd really like to hear from you if you were interested in doing any of that. We're also very involved in research. We support patient engagement and involvement in research. So a lot of our outreach team will be involved in different projects with different healthcare professionals across the UK. So it's an opportunity to get patients involved in some research. So this could be anything from doing a survey to getting involved in a research project, to reviewing materials, to getting advice and information, or asking someone to be part of a clinical trial. So we've got a whole section on our website dedicated to research. So anything that we get from research, we want to empower patients so that these results can really impact policy and healthcare practice, so we can take this forward and continue to be there for the people in the future who get diagnosed. And as I've mentioned, if you want to hear that was a snapshot of what we do as an organization. I could sit here and talk for hours about everything that we do because we do so many different things, but I wanted to give you just an overview of some of the current things that we're up to at the minute. But if you wanted to learn a bit more and read a bit more about what we're doing, you can keep up to date with all things of publications, our groups, our news and latest blogs, any of our active campaigns, and you can do that on our British Liver Trust website, which is www.britishlivertrust.org.uk. You can also follow us on social media. So we're on Twitter, we're on Instagram, and we're on Facebook as well. And if you are around and you see one of our Love Your Liver roadshows in your area, please do come and say hello. We'd love to see you, and we'd love to be able to support anyone who wants to come. So I just want to say a big thank you. Thank you to the Virtual Village Hall for giving us this opportunity to come in and do this session and educate people. I hope that you found it interesting. I hope that you learned something different. But as I mentioned at the beginning of this talk, I really hope that throughout this that you were inspired to take one piece of advice away with you that you will put into your life that will help to promote your liver health. And one little change can make a big difference. So I really hope that you've learned something today. And thank you very much for listening to me, and enjoy the rest of your afternoon.